The Qingyi Community Isolation Facilities was constructed when the fifth wave of pandemic has become severe in Hong Kong. The project was finally completed in 7 days and was opened to the public on the 1st of March 2022.
The fifth wave of the COVID-19 outbreak hit Hong Kong hard last December and revealed the imminent need for community isolation facilities. Within a week, the task force led by the Development Bureau identified 8 possible sites for the construction of community isolation facilities. One of these is in Qingyi. The teamwork between different parties shortened construction time by a considerable amount.
I think the spirit of mutual help between departments and the construction team is also very essential for this fast-track project. We have to communicate with the building contractor so that we can know what's the constraints they are facing within the 7 days. The sourcing and transportation of prefabricated modular units to Hong Kong for the isolation facilities is also a very big challenge.
Land scarcity is always a problem in Hong Kong. It is also a headache when it comes to storing construction materials. The Civil Engineering and Development Department was there to help. They coordinated with different departments to provide the necessary assistance to support the construction work.
We work out a temporary traffic arrangement to close 2 traffic links of the road next to the site for serving as a temporary works area. With the support from Transport Department and the police, we took only 1 date from concept development to obtaining the approval. The interdepartmental efforts from various government departments, as well as the concerted efforts of the contractor and utility undertakings, all these have enabled us to complete the works within a very short period of time.
Carrying out underground work was not any easier. The Drainage Services Department had to find a new path for the sewage pipe in the already complex pipeline network. The department finished building the sewage system for the Qingyi Community Isolation Facility within a week, compared with a normal construction period of 3 weeks. Their senior engineer shared an almost pipeline crash story.
Toward the end of the sewer construction, we noted that there will be opportunity our sewer may clash with a water main. Therefore, we immediately contact the colleague of the water supply department. In case they indeed clash, then the colleague can stand by and carry out the diversion work immediately. Fortunately, after our more accurate site survey, our sewer is just able to pass over.
The Development Bureau also brought in public utilities and telecoms providers to ensure supporting facilities were in place upon the operation of the Qingyi site.
Upon receiving our request, the power company immediately arranged the cable laying and other relevant works so as to ensure the power supply could be provided upon the completion of the facilities. And for some area with network coverage relatively weak, we contact the network company immediately. They also carried corresponding works to enhance the network coverage after receiving our request.
With personnel working around the clock, the facility was able to commence service amidst the most needed period. It provides around 3,900 beds for emergency isolation, mainly for the admission of infected persons with no or mild symptoms.